Okay, so we are recording. Thank you so much for doing this again. I guess let's get into it with the questions. So the first question was, when was your first pericarditis episode?
Yeah, so that was April of 2022. Yeah.
And what were your first initial symptoms during the first episode? How did you start feeling and all of that?
So it was at, in the evening after actually a night out. I came back home. I had a little bit to drink, but nothing crazy. And I started feeling this weird pressure on my chest. Like nothing super uncomfortable, but I couldn't really place it. And I was having trouble taking deep breaths. So I told my girlfriend, like, hey, go to bed. I'll be right there. I'll just have a cup of tea and, you know, wait until this goes away. Kept getting
Mhm.
worse. And then I started getting a stinging feeling in my chest, like right in the middle. Not really where the heart is, just middle of the chest. And that pain started radiating to my left shoulder. That's when alarm bells obviously started ringing. So that's when we called an ambulance.
Did you think that you were having a heart attack because of the arm pain?
Yeah, the shoulder, the radiating shoulder pain is always obviously a big warning sign. And the fact
Yeah.
that I couldn't take big, deep breaths and the pain was like pretty bad. I'll soldier through a lot of things, but this was very hard to, yeah, fight
And
against.
how long did it last for, the
Um,
symptoms?
the first time, well, I was hospitalized during this episode.
Hmm.
And they started giving me pretty decent painkillers. I was actually in the ICU for the first 2 nights because my heart rate was really high and it wouldn't go down. Like that was another big symptom, a racing heart. I felt like I was running a marathon without actually doing anything, sitting still or lying down. So this lasted about, I would say, 2, 3 weeks. The first week I was in the hospital, and then they let me go home, gave me some beta blockers to slow down my heart, some decent painkillers, and obviously the other stuff. And
Hmm.
yeah, about 3, 4 weeks. After that, I felt better, but there was always this pressure on my chest, which wouldn't quite leave, even when I felt decent and was, participating in normal life again.
Hmm. And you mentioned that you had COVID shortly before you got sick. How shortly before was that?
Um, I would say about a week, 2 weeks before.
Hmm.
Yeah, about that. I was about feeling better from COVID, and then the party started.
And then boom.
Yeah, and then yay.
Yeah. And then how did you get diagnosed? What kind of tests did they run when you were hospitalized the first time? Did you get chest x-rays, EKGs?
Yeah, the whole lot, actually. EKGs, then they did a CT scan actually
Hmm.
with contrast fluid where they saw some effusion. Before that, they actually did an echo, so the CT was to confirm the effusion. Um, yeah, and I think that's about it. Yeah, EKG, CT, and heart echo. And obviously they were looking at my symptoms and going like, oh, we can't place them anywhere else. So the infusion was a
Hmm.
big sign.
Hmm. And what was your experience with the doctors? You said, well, you were diagnosed pretty early on, like in 2022. Were they very clear about what you had, or
They
yeah.
shrugged it off, actually. Well, they obviously treated me for it and they said, you have pericarditis, but they basically gave me a very good outlook. They said, like, look, this is going to be over in 2, 3 weeks. You feel horrible right now, but you'll be feeling fine then.
Mhm.
In most of the cases, it doesn't come back. So really nothing to worry about. Just stick to your medication and you'll be fine. And actually, when I came in to the hospital, at first they were very skeptical of my symptoms. It was early in the morning, and I had drunk something, obviously, but not a lot. And they basically said, yeah, this is due to substance abuse and all sorts of things. I said, like, please test my blood. I'm clean. I drank a little bit. And later it actually turned out I was even still able to drive here. So it's nothing
Oh,
serious.
so
Yeah.
they thought you were on drugs or something.
Yeah, they said like, have you taken any cocaine? Have you taken any uppers, any kind of speed, amphetamines? I'm like, no, guys, just chill. I have a high heart rate. I feel horrible. Please help me. They're like,
Oh
yeah,
my
you've been.
God.
Yeah, it was. Well, this country is known for being very conservative and the people
Oh
very
yeah.
straight to the point. So yeah, that was not a very pleasant experience. And then in the future, when I came back from my checkups, even when I said I was still feeling pain and chest pressure and not being able to exercise, my doctor was like, yeah, you just be patient. It's not as bad as you claim it is. You'll be fine. Um, but now, a couple of years on, I was hospitalized recently again, and I was they diagnosed me with myocarditis this time,
Mhm.
which was a step up from the previous experiences.
Mhm.
And I was kind of, yeah, I was actually very down when I got this diagnosis, and the doctor saw this. And I was like, for the love of God, I've been telling you guys this whole time I'm feeling something, and you just keep on claiming you don't see anything. And then this medic was very kind with me, and he told me, like, listen, the fact that we don't see something doesn't mean that there isn't something there. And this has stuck with me because I have a feeling that there's still a lot that they don't know about this disease, especially in relation to COVID.
Mhm.
And yeah, sorry, I'm getting off point.
No, 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 please go ahead, continue. I'm sorry to hear that you were hospitalized again recently.
Yeah, well, I'm getting used to it. It's kind of weird being on a first name basis with most of the doctors and the nurses there. But I take it in good spirits nowadays. I mean, it we have a very good healthcare system in this country. I mean,
Mhm.
the doctors obviously don't know completely what they're doing with this disease, but I don't think that's something that's unique to Austria. Um, yeah, so
Yeah, I
at least
believe
I'm getting
nobody
help.
knows.
No, and like even with this ARCALYST similar medication I'm taking, um, I was basically hospitalized, and I was like, I can't keep taking this cortisone because steroids have been horrible on me, both mentally and physically.
Mhm.
Mood swings, swelling, weight gain, the whole shazam. And I was looking for an alternative, so I started reading medical journals and the whole lot, as you do. And I came across this, and it was actually me suggesting it to my treating doctor, like, hey, sir, maybe it would be a good idea to approach this disease from a different angle. He's like, oh, yeah, that's a great point. I'll see if I can get you prescribed. It's
Oh,
really
great.
weird, surreal experience. Yeah.
Do you have free healthcare and did they give you the Arcalist for free?
Yes,
Oh, that's
and
awesome.
yes. Yeah, it's part here. So if you work for a certain amount of time, you basically have the right to free healthcare, which is a God-given. Because before I was living in Brazil, and you can imagine the contrast. So yeah, I'm very happy that this happened to me here and not in Latin America.
Oh yeah. Yeah, I can imagine. Well, how so currently your treatment right now is just Arcalist. You're not on colchicine anymore.
No,
Not
I am still on colchicine as well as some additional PPIs for my stomach
Mhm.
because I've been having very bad digestive issues because of all the medication I'm taking. Probably that's what they're assuming now. They still don't know. Could be because of the long COVID as well. Some pain medication. Unfortunately, I'm taking opioid pain medication now because the other stuff was doing a wreck on my liver.
Oh.
And what else? Yeah, some sleeping pills every once in a while, but yeah, quite a lot. Oh, and some stuff for my gastritis. It's a whole, yeah, plethora
Yeah,
of
I mean, do you
things.
think the gastritis could be related to all of the medication that you've been taking for like almost 3 years?
Oh yeah, quite probable. Colchicine is known to cause stomach and issues lower down in the digestive tract.
Mm-hmm.
When taken for a longer time, it's a fairly common side effect. So, and yeah, my liver hasn't been doing great because of all the NSAIDs before, NSAIDs. Sorry if I'm not
Yeah.
good with the abbreviations.
No, it's okay. The ibuprofen and all that stuff.
Yeah, all that jazz.
Um, and so what's the treatment outlook for you? What do they have in mind? Are you going to continue with the Arcalyst and colchicine indefinitely, or what did
It
they tell you?
Yeah, they haven't really told me anything, but we've been basically trying the guinea pig approach previously with colchicine and cortisone. So just reducing it until I had another flare up, and oh, like, okay, we need to up it again. I presume they're going to do the same with the Arcalyst this time, because again, they don't really know what they're doing, which I can't blame them for, but yeah,
Yeah.
it's especially this Arcalyst treatment, it's still fairly experimental. It's actually being used as an off-label treatment, so it's not commonly prescribed for this disease.
Hmm.
But yeah, we'll see. We're coming to the 6 month mark now, and I had another flare-up recently, so that would speak against reducing. We don't know, basically, if the outlook is good or bad. We just don't know.
Yeah. Would you say that the Arcalyst reduced the frequency of flare-ups? Have you had less flare-ups during being the time you've been on Arcalyst for?
I would say they're less intense.
Okay.
They're still present. Like even like if I do something stupid as lift something heavy or cook a big meal or something, I suffer the consequences the next couple of days.
Mm.
Um, but I guess it's gotten not as bad. I don't, yeah, I couldn't really tell a big difference or not. Uh, it seems that this stuff would start really fully working after 6 months. So we'll see.
Yeah, hopefully it gets less and less until you can taper off of it.
Yeah, because it's injections, and I'm not a fan of needles, never have been.
Oh, and how
And
often do
yeah,
you get?
daily.
Oh, daily injections? Once a day?
Yeah, yeah,
Okay. Do you do them yourself?
yeah. I have to. My phobia wouldn't allow me otherwise. I mean, I accept medical personnel doing it, but I would never imagine my girlfriend doing it.
Oh no.
I don't think she would like to either.
Yeah. Um, okay. So what symptoms do you experience on a daily basis? And then what symptoms do you experience during flare-ups?
So daily symptoms are basically just fatigue, chest pressure, uh, pain in different regions of my chest. It's usually like left-sided where the heart is, but sometimes it moves around a bit to where the pancreas is or even stomach lining and stuff. It's weird. Um, I get a fairly high heart rate fairly quickly. So if I stand up, sit down, move around, I can't walk
Mhm.
too fast, can't walk uphill too fast, stuff like that. So sports are completely out of the question, which is a shame because I used to love them.
Mhm.
Um, yeah, basically. And when I have a flare up, it's basically that, but worse. And the chest pressure gets so bad that I feel like I almost can't breathe. Like I have a belt around my chest, just constantly
Mhm.
being tightened. And then extreme pain, stinging pain around the heart with accompanying pain in jaw and shoulder, the back sometimes. Sometimes my left arm goes numb. Um, Digestive issues, nausea, yeah, it's quite a mix of a lot of symptoms. But they usually a flare up for me is usually I just consider it to be when everything gets worse because the nausea is also a constant companions nowadays. It didn't used to be.
Oh, I see. And how long do your flare-ups last for?
2 3 weeks mostly, sometimes a
Oh,
month,
okay.
sometimes longer.
Do you get days like the beginning, is it worse for a few days and then it progressively gets better, or is it just 2 or 3 weeks of like constant bad symptoms?
I would say the first 2 weeks are usually the worst, where they stay fairly constant and bad, like I stay symptom-wise, and then after that, the week after that, it tapers off and gets to a gradual better baseline. Like,
Okay. Do you have any tips? Like, how do you manage to sleep during those flare-ups?
so I've read a lot of people writing about like wedge pillows and stuff like that. That usually tends to help. So lying on my side and trying to keep my chest slightly elevated. Um,
Hmm.
and yeah, when it's really, really bad, I tend to take a lot of warm showers and have a hot flask close by. That usually tends to help as well. Lots of tea
Okay. Yeah, tea really helps.
and breathing exercises as far as possible. But yeah, also, again, that's sometimes tough when you have a feeling that there's an elephant just sitting on your chest, you know?
Yeah, yeah, definitely. I can totally empathize with that. It's hard to do the breathing and be calm when you can't breathe.
Yeah, exactly.
Yeah. So let's see. Next question would be, what symptoms would you look out for before you decide to go to the ER?
So, spike in heart rate,
Hmm.
um, definitely. Yeah, night sweats. That's actually something I've forgotten to talk about before. It's a fairly common symptom I've read, and I also have it, which it gets a lot worse when I'm having a flare up. So you basically wake up just yeah soaked. Um, change your bed sheets and everything because it's that bad.
Hmm. Hmm.
Spike in heart rate, yeah, a spike in pain, and getting these spikes more often is also a big warning. And if I have trouble like sitting down, standing up, if that becomes too much, then I know it's time to get to the ER again.
Hmm. Hmm. And what does your life look like currently in the present? What does your routine, your daily routine look like right now?
Not much. Wake up, have a cup of tea, switch on my computer. I built myself a gaming computer recently. It's the one thing that has kept me sane through these 2.5 years.
Hmm.
Um, yeah, and then in the evening, the lady comes home and watch the series. She's been a big support. So yeah.
That's awesome. Do you have any
Why?
pets?
Sorry?
Do you have any pets?
Yeah, we got a cat actually 1.5 years ago.
Oh,
So he's been a steady companion as well. Yeah,
yeah,
it's
I'm
good to
sure
have
that
some
really
company.
helps.
Definitely, the company is a big plus. And he's just, he's not a very cuddly one, but he's just present in the room whilst I'm
Mhm.
gaming. That's all I need. It's good company. It's good company.
Yeah. You know, this is off topic, but I've read that cat purring is it like emits this certain frequency that can heal people's illnesses. And so
Definitely.
in ancient cultures, people would keep cats around because their purr would help them heal and live longer.
I should try and get him closer then, because as I said, he isn't very cuddly. But I've read this about the cat's frequency purr as well, that it has healing properties because it stimulates certain yeah receptors or something.
Yeah.
Yeah.
I was considering getting a cat and just like sleeping with it on my chest to see if it heals my heart.
I
Anyway,
mean, I couldn't recommend against it. Who knows? Might
who
actually
knows?
help. Yeah.
Yeah. Sorry, that was a little off topic,
No,
but
it's
we're
fine.
considering
It's fine.
multiple treatment options for this at this point.
Yeah, exactly. Even holistic alternative therapies are very welcome.
Yeah. Oh, so that gets us to the next question. Have you tried any kind of alternative medicine or treatment for the pericarditis?
So I'm not sure if meditation and breathing exercises would count, but I guess
Yeah,
that.
definitely.
Okay, well then that. And like certain foods I've been trying to take more, which have anti-inflammatory properties like garlic, ginger, cloves, yeah, stuff like that. Turmeric,
Mm-hmm.
turmeric is very, very good for you. I read saw someone writing that he takes a lot of turmeric tea. That helps him a lot as well. Yeah, stuff like that, but that's about it. Nothing really
Yeah.
special.
What kind of meditation practice do you do?
Mostly mantras and just breathing and visualizing. It's yeah.
Do you have any mantras that you would recommend for the people listening to this?
They're quite personal,
Oh, okay.
but one of them I would like to share is there's a beginning, there's a middle, and there's an end, and that is to everything in life, and also hopefully to this we can
Hmm.
assume because nothing is permanent. So yeah.
Yeah, that's helpful. Um, so what does your diet look like right now? You mentioned that you sometimes you eat these foods that have anti-inflammatory properties. Do you eat meat? Do you drink alcohol and all that kind of stuff? Can you describe your diet?
Yeah, sure. I used to drink quite a lot. I used to work in the restaurant industry, so kind of perk of the job. I've obviously stopped completely with that, because alcohol makes me feel pretty bad. It raises my heart rate, and the next day it feels basically like a regular flare-up, just as a hangover. So I try to definitely avoid that. I started eating a lot more fish. The fatty acids tend to help a lot for heart health.
Mhm.
And then avoiding red meats, unfortunately, because I love those. Avoiding fatty meats, so I don't eat a lot of pork anymore. Also, unfortunately, because I love it,
Yeah.
like bacon and stuff like that. It's unfortunately, I know I love it, but I know it's not good for me. So try to avoid that. Like deep fried, stir fried stuff is just, yeah, it wreaks havoc on me, especially over like the next couple of days after. So that's not
Hmm.
good. Yeah.
Yeah. And how did you feel emotionally on average before you got pericarditis?
So my job was going pretty good. Um, I was working in a restaurant responsible for the cocktails and the service, which was awesome. I was invited to become part owner, which was obviously awesome. Um, yeah, my relationship was going in a good direction. We were thinking of getting married, getting kids. So yeah, pretty good. Like was doing a lot of sports, hiking, snowboarding in the winter, ski touring, which is where you hike up a mountain and then snowboard down. Pretty awesome.
Mm.
Lots of paddle boarding in the summer, swimming. You're like, yeah, a very, very nice life. I was very happy with everything. It was going all in the very nice direction, considering I was, starting going towards the middle of my 30s. And yeah.
Hmm. Hmm. And what's your how do you feel emotionally on average now these days?
Uh, yeah, I'll keep it short, but frustrated and depressed, basically. It's very hard not being able to do the things I used to be able to do.
Yeah, I'm sorry to hear that.
That's all right.
Mm.
We'll have to go through this, I
Do
guess.
you get to go into nature and like walks in nature where you are?
So we recently moved a little bit out of the village. We're basically in the middle of some meadows. You know The Sound of Music, the
No.
movie? Okay, well, it's like super picturesque, idyllic mm, picture of Austrian society. It's very kitsch.
Oh, let
That's
me look it
basically
up.
where I live. It's amazing. It's like it's rolling meadows and rough mountains on the side, and it's a beautiful place. So I do go for short walks every once in a while. And we have this little bench in the middle of the meadows there, where I just sit and look at the mountains. It's
I
quite
just
nice.
looked up on Google The Sound of Music and it's so pretty. You live in
Yeah,
the like mountains.
well, I live actually in the region where that music was shot, where that movie was shot.
Okay.
Salzburg. Yeah,
Oh yeah, look at
it's
the
an amazing
meadows.
place. It's amazing.
Probably gets really cold in the winter, right?
We just got snow today. Gets like -11 at night now. Yeah, I'd
Okay.
I'd be getting pretty psyched for that normally, because that means on the up on the mountain the snow is getting good for snowboarding.
Mm.
But yeah, not so much anymore.
Hopefully soon.
We'll see. We'll see. Let's hope this treatment works.
Okay, yeah. So, you mentioned that you don't drink anymore, you don't smoke, no
I
drugs.
haven't said anything about smoking. Um, I used to smoke quite a lot. I stopped smoking regular cigarettes, but I still smoke grass
Oh,
because
okay.
it helps me to calm down, and apparently is supposed to have some therapeutic properties as well. I'm not
I
sure,
see.
but it does help. So yeah.
Yeah. And do you have a history of anxiety or depression?
Nope. Never had any. I had, I think, one panic attack as a adolescent, but that's quite a while ago.
Yeah.
Never had anything. And that's actually funny that you mentioned that because that was the one thing the doctors were constantly hammering on about. You must have anxiety, this chest pressure. You're imagining things. It's definitely anxiety. It wasn't.
Yeah.
The several hospitalizations have proven them wrong. And
Yeah. I can relate to that. Like the first doctor that looked at me at the ER told me that I was having a panic attack.
yeah,
It was wild. He referred me to a psychiatrist.
yeah, that sounds so familiar. And I'm so sorry, by the way, for everyone who is listening. If don't take that for granted, stand up for yourself. That's another tip I would like to give you. Doctors, most of the time, they don't really know what they're doing. Pericarditis usually goes by pretty quick. But in the cases of people who are listening, I guess it hasn't. So stand up for yourself. Like get tests done, get checkups, get second, third, fourth opinions. Like don't give up. It's
Yeah.
hard, it's tiresome. I know it is, but just, hang in there. We have to stand up for ourselves because we have been unheard for a very long time.
Yeah. That's very good advice. Thank you for saying that.
Cheers.
Um, so let's see. I have asked you about alternative and holistic medicines. Yeah, so I guess like the last thing would be, if you could give a word of advice for people who have been diagnosed with pericarditis or any insights or tips that have worked for you to help ease your symptoms, what would it be?
I think in the beginning I underestimated the amount of rest I needed, especially after the first episode. That might be a reason it came back as well. So do not underestimate the amount of rest that you need to take. Like you need a lot. And then when you think you had enough, you need some more. 3 months is good, 6 months is better. If you have the possibility to take off work or stop working, it is probably the best course of action. Even though it's harsh and difficult, but it will help you in the long run, especially if you're a first timer. Um, do not do or please make your first time be your last time. That is another thing I would like to say. And don't be too harsh on yourself. Like I feel like I am sometimes because I can't do the things I used to, and that is tough. But
Hmm.
like you are sick, you are not imagining this, you know, and don't be too hard on yourself. You'll get through it, but you need to chill. I guess that would be yeah, besides the thing I said before.
Great. Thank you so much. Thank you so much for sharing it. Is there anything else that you'd like to share with the audience or the people that are listening to this?
I just really like the community. I'm very grateful for everyone to be being there. Like it's amazing reading other people's experiences, and I'm very grateful for everyone sharing them. It makes us all feel less lonely in this. And yeah, thanks for having me. It's been great.
Yeah, of
Appreciate it.
course. Thank you so much for your time and for sharing your story. I'd also like to thank the people in the community. It's amazing, the Discord group. Oh yeah, so for anyone listening to this, if you haven't come across it already, there's a Discord support group for people with recurrent pericarditis. And yeah, there's a bunch of people there who've had this for years or for months, and you can share your story, ask for tips or for just emotional support. It's a really great community and people are really kind. And yeah, if you've just been diagnosed with this, I hope that you feel less alone by listening to this. You're not alone. There's many of us out there, and I hope that you take care of yourself. And like he said, advocate for yourself, advocate for your condition, and I hope you get healing.